CNA Practice Test questions and answers. You have a patient that only likes to shower once weekly. It is important for you to realize what A. Your facility has a shower schedule, and the patient needs to be educated on her allotted shower time. B. Cultural differences in bath taking are often overlooked by healthcare professionals. C. The patient's family needs to be aware of the patient's refusal to bathe. D. The patient is at high risk for depression if she does not shower more often than once weekly. Correct answer, B. Cultural differences in bath taking are often overlooked by healthcare professionals. Cultural norms may influence bathing frequency. Healthcare workers should respect cultural preferences and collaborate with patients to find acceptable solutions without forcing practices. A patient who does not drink adequate fluids is at risk for all of the following except A. Mouth sores. B. Bad breath. C. Skin ulcers. D. Swollen gums. Correct answer, D. Swollen gums. Dehydration causes mouth sores, bad breath, and skin breakdown. Swollen gums are typically due to dental issues, not dehydration. Indications of pain in an 85-year-old patient can include all of the following except A. Insomnia. B. Seclusion. C. Participating in social events. D. Agitation. Correct answer, C. Participating in social events. Pain often leads to withdrawal from social activities, insomnia, and agitation. Participation in social events is not a pain indicator. The focus of providing ADLs, activities of daily living, to patients includes the following except A. The comfort of the CNA. B. Comfort. C. Safety. D. Dignity and respect. Correct answer, A. The comfort of the CNA. Patient-centered care prioritizes the patient's comfort, safety, and dignity, not the CNA's comfort. What is the proper measurement unit for bodily fluids? A. Ounces. B. Liters. C. Milliliters. D. Fluid ounces. Correct answer, C. Milliliters. Milliliters, ml, are the standard unit for measuring bodily fluids in healthcare. A Foley catheter bag contains 350 milliliters of urine. Why is this concerning? A. Indicates kidney failure. B. Reflects adequate hydration. C. Suggests overhydration. D. Requires immediate nurse notification. Correct answer, D. Requires immediate nurse notification. Urine output should be greater than or equal to 30 milliliters per hour. 350 milliliters over 12 hours, almost equals 29 ml/hour, signals potential kidney dysfunction. A patient on strict dysphagia precautions receives a lunch tray. Which item should be questioned? A. Regular orange juice. B. Mashed potatoes. C. Jell-O. D. Applesauce. Correct answer, regular orange juice. Dysphagia patients require thickened liquids. Regular orange juice poses an aspiration risk. A patient with fruity breath, sweating, and confusion requires A. A POC glucose test. B. Orange juice. C. Air conditioning. D. Oral hygiene. Correct answer, A. A POC glucose test. These symptoms suggest hypoglycemia or hyperglycemia. A glucose check is critical. Which is essential for diabetic foot care? A. Heating pads for cold feet. B. Daily warm foot soaks. C. Keeping feet dry and clean. D. Clipping toenails short. Correct answer, C. Keeping feet dry and clean. Diabetic neuropathy increases infection risk. Clean, dry feet prevent skin breakdown. A bedbound patient is at risk for A. Dysphagia. B. Polydipsia. C. Muscle atrophy. D. Impaction. Correct answer, C. Muscle atrophy. Immobility leads to muscle wasting. Range of motion exercises are crucial. A stroke symptom includes A. Drooping on one side of the face. B. Foaming at the mouth. C. Eye rolling. D. Urinary incontinence. Correct answer, drooping on one side of the face. Facial asymmetry, e.g., uneven smile, is a hallmark stroke sign. The best way to prevent germ spread is A. Wearing gloves. B. Hand washing. C. Mask and gown use. D. Isolation. Correct answer, B. Hand washing. Hand hygiene is the most effective method to reduce transmission. A patient lying supine is positioned A. At 90 degrees. B. Flat. C. At 30 degrees. D. At 45 degrees. Correct answer, B. Flat. Supine means lying horizontally on the back. An example of subjective data is A. Pain level 7 out of 10. B. Temperature 101.2 degrees Fahrenheit. C. Eggs for breakfast. D. BP 120/80. Correct answer, A. Pain level 7 out of 10. Subjective data is reported by the patient and not measurable. A pulse oximeter measures A. Blood oxygen levels. B. Blood CO2 levels. C. Lung CO2 levels. D. Heart oxygen levels. Correct answer, blood oxygen levels. It non-invasively measures peripheral oxygen saturation, SpO2. For stress incontinence, prioritize A. Foley catheter use. B. Frequent toileting. C. Fluid restriction. D. Diuretics. Correct answer, B. Frequent toileting. Scheduled toileting reduces bladder pressure and accidents. Sudden confusion in an elderly patient may indicate A. UTI. B. Headache. C. Sinus infection. D. Hunger. Correct answer, UTI. UTIs commonly cause acute confusion, delirium, in older adults. Contact precautions are required for A. Tuberculosis. B. COVID-19. C. MRSA. D. Pneumonia. Correct answer, C. MRSA. MRSA spreads via direct contact. Use gloves and gowns. Restraints should be secured to A. Bed frame. B. Upper bed rail. C. Lower bed rail. D. Bed headboard. Correct answer, bed frame. The bed frame is stationary, preventing injury from rail movement. How many fingers fit under a wrist restraint? A. 1. B. 0. C. 2. D. 4. Correct answer, C. 2. 2 fingers ensure restraints are snug but not restrictive. For transferring a weak patient, use A. Hoyer lift. B. Sit-to-stand lift. C. Gait belt. D. Slide board. Correct answer, C. Gait belt. A gait belt assists with safe transfers for mobile but weak patients. Teach a pneumonia patient to A. Cough/deep breathe. B. Restrict fluids. C. Avoid movement. D. Skip therapy. Correct answer, cough/deep breathe. Promotes lung expansion and mucus clearance. Wrinkled sheets increase the risk of A. Pressure ulcers. B. Falls. C. Infections. D. Patient complaints. Correct answer, pressure ulcers. Wrinkles create friction/shear, leading to skin breakdown. A diabetic patient with confusion requires A. Temperature check. B. Glucose test. C. Pupil exam. D. Pulse check. Correct answer, B. Glucose test. Hypo-/hyperglycemia can mimic neurological symptoms. Incontinent patients risk A. Pressure injuries. B. Dehydration. C. Depression. D. Anxiety. Correct answer, pressure injuries. Moisture from urine/feces weakens skin integrity. Strict INO monitoring includes A. Solid food tracking. B. NPO status. C. Morning/night urine. D. All liquid intake/output. Correct answer, D. All liquid intake/output. INO tracks fluid balance, measure all liquids, ml, and urine. Avoid the abbreviation. A. TID. B. BID. C. QD. D. NPO. Correct answer, C. QD. QD, daily, is error-prone, write daily instead. Correct perineal cleaning technique. A. Front to back. B. Back to front. C. Circular motion. D. No wiping. Correct answer, front to back. Prevents fecal contamination of the urethra/vagina. Transfer an immobile patient with A. Gait belt. B. Mechanical lift. C. One-person assist. D. Slide board. Correct answer, B. Mechanical lift. Ensures safe transfer for non-weight-bearing patients. Secure a Foley catheter to the A. Bed rail. B. Upper thigh. C. Lower thigh. D. Knee. Correct answer, B. Upper thigh. Prevents catheter dislodgement and urethral trauma. Evening confusion in elderly patients is A. Dementia. B. Sundowning. C. Psychosis. D. Delirium. Correct answer, B. Sundowning. Increased confusion/agitation at night due to circadian disruption. COVID-19 increased resident. A. Isolation. B. Fear of death. C. Anger. D. Anxiety. Correct answer, A. Isolation. Visitor restrictions heightened loneliness in long-term care. Delirium symptoms include A. Hallucinations. B. Tearfulness. C. Weakness. D. Speech loss. Correct answer, A. Hallucinations. Delirium involves acute confusion, hallucinations, or delusions. Attention-seeking behavior excludes A. Attending social events. B. Excessive call light use. C. Refusing therapy. D. Refusing family visits. Correct answer, A. Attending social events. Social participation is healthy, other behaviors signal unmet needs. Manipulation example. A. Paying complaints to new staff. B. Lying to peers. C. Medication refusal. D. Skipping meals. Correct answer, A. Paying complaints to new staff. Manipulative behavior seeks to control care through deception. Elderly mental health triggers exclude A. Spouse's death. B. Financial loss. C. Faith activities. D. Declining health. Correct answer, C. Faith activities. Faith groups often provide support, reducing isolation. Postmortem care requires A. Open doors. B. Privacy. C. Family exclusion. D. Immediate cleaning. Correct answer, B. Privacy. Maintain dignity by closing doors/curtains, even after death. Approaching death sign. A. Appetite loss. B. Increased energy. C. Activity spikes. D. No changes. Correct answer, A. Appetite loss. Reduced intake is common as bodily functions slow. Proper introduction to a new resident. A. Use care plan name. B. Ask preferred name. C. Skip introduction. D. Assume prior notice. Correct answer, B. Ask preferred name. Respect preferences to build trust and rapport. A grimacing patient reluctant to report pain needs. A. Pain acknowledgement. B. Dismissal. C. Family notification. D. Secret keeping. Correct answer, A. Pain acknowledgement. Cultural or personal factors may inhibit pain reporting, offer support. Communicate with a blind patient by A. Loud speech. B. Clear speech plus introduction. C. Hand holding. D. Privacy invasion. Correct answer, B. Clear speech plus introduction. Announce presence, speak clearly, and ensure the patient knows your location. A talkative patient during busy care requires A. Subtle exit. B. Task continuation. C. Kindly reschedule. D. Ignoring others. Correct answer, C. Kindly reschedule. Balance care duties with empathy, return later to listen. Entering a dying patient's room. A. Start care silently. B. Inform daughter. C. Let family care. D. Knock plus explain. Correct answer, D. Knock plus explain. Maintain respect, hearing may persist even if unresponsive. A resident crying over skipped bingo needs. A. Dismissal. B. Pressure to attend. C. Empathy plus discussion. D. Ignoring feelings. Correct answer, C. Empathy plus discussion. Validate emotions and explore reasons for withdrawal. Finding unlabeled pills requires A. Administration. B. Disposal. C. Confidentiality. D. Nurse notification. Correct answer, D. Nurse notification. Unlabeled medications risk safety, report immediately. A cluttered room should be addressed by A. Secret cleaning. B. Threats. C. Safety discussion. D. Family calls. Correct answer, C. Safety discussion. Collaborate with the resident to address hazards while respecting autonomy. A suicidal resident requires A. Dismissal. B. Investigation. C. Secrecy. D. Acceptance. Correct answer, B. Investigation. All self-harm threats must be reported for evaluation. A misplaced item report requires A. Dismissal. B. Search assistance. C. Police call. D. Family blame. Correct answer, B. Search assistance. Memory impairment may cause confusion, assist in locating items. Suspected theft by staff requires A. Ignoring. B. Confrontation. C. Theft reversal. D. Inquiry plus report. Correct answer, D. Inquiry plus report. Protect resident rights, escalate suspicious behavior. A crying resident in public should be A. Moved privately. B. Ignored. C. Scolded. D. Family called. Correct answer, A. Moved privately. Ensure confidentiality and provide emotional support. Financial abuse concerns require A. Reassurance. B. Supervisor report. C. Police calls. D. Family alerts. Correct answer, B. Supervisor report. Financial exploitation is reportable, let authorities investigate. Physical abuse reports require A. Secrecy. B. Nurse notification. C. Family alerts. D. Dismissal. Correct answer, B. Nurse notification. Mandated reporting ensures resident safety and legal compliance. Hidden call bells indicate A. Neglect. B. Gratitude. C. Fake replacements. D. Safety. Correct answer, A. Neglect. Residents have the right to call for help, report neglectful acts. Unchecked restraints risk A. Neglect charges. B. Legal immunity. C. False claims. D. Harm acceptance. Correct answer, A. Neglect charges. Regular restraint checks are legally required for safety. Ignoring a lonely patient's calls constitutes A. False imprisonment. B. HIPAA breach. C. Neglect. D. Emotional harm. Correct answer, C. Neglect. Neglect includes failing to respond to resident needs. Incident reports help. A. Identify trends. B. Assign blame. C. Diagnose weakness. D. Inform families. Correct answer, A. Identify trends. Reports improve safety by analyzing incident patterns. Universal precautions apply to A. All patients. B. Open wounds. C. Fevers. D. Coughs. Correct answer, A. All patients. Assume all patients may carry pathogens, use standard precautions. C. Diff precautions require A. Mask. B. Gown. C. Face shield. D. N95. Correct answer, B. Gown. Contact precautions, gown/gloves, prevent spore transmission. Influenza requires A. Contact precautions. B. Droplet precautions. C. Reverse isolation. D. Blood precautions. Correct answer, B. Droplet precautions. Influenza spreads via droplets, use masks and distancing. Fostering independence involves A. Encouraging self-care. B. Cutting food. C. Meal scheduling. D. Clothing selection. Correct answer, A. Encouraging self-care. Promote autonomy by supporting patient participation in ADLs.